The blood lead test is used to screen for exposure to lead and also indicated for children considered to be at risk from 18 months to 6 years of age, and when your occupation or hobby may expose you or your family to lead, when you have symptoms suggesting lead poisoning. The sample required is a blood sample taken from a vein in your arm or by finger stick or heel stick for infants. Lead is a soft metal present in the environment. When it is inhaled or ingested, lead can cause damage to the brain, organs, and nervous system. This test measures the current lead level in the blood. Even at low levels, lead can cause irreversible damage without causing physical symptoms. In an infant, lead can cause permanent cognitive impairment, behavioral disorders, and development delays. Lead can be passed from mothers to their unborn children and can cause miscarriages and premature births. Blood lead tests should be ordered to screen adults in the workplace when lead contamination is a possibility, such as smelter facilities, lead plating, auto repair, and construction. Adults who have hobbies that involve lead-based paints, ceramics, or gasoline also should be tested. The higher the test result, the more lead is in the blood. However, the amount of lead in the blood does not necessarily reflect the total amount of lead in the body. This is because lead travels from the lungs and intestinal tract to the blood and organs, and then is gradually removed from the blood and organs and stored in tissues such as bones and teeth. In pregnant women, lead can pass through the blood to an unborn child. Poisoning with lead is more harmful for children, whose brains and other organs are still developing. Adults tend to recover from lead ingestion better than children. Lead interferes with the absorption of iron. Children with raised blood lead concentrations should
Today's
be
topic
tested
we're going to
for
talk
iron.
about is blood lead. First things first, I'm going to introduce myself. My name is Shamsaf Shami bin Swaime. I'm with two other members is Shafi and Shazwan. Our lecturer name is Madam Intan. For second slide, introduction to blood lead. Blood lead is a significant public health concern as elevated levels can have serious health consequences, especially for children. Understanding the sources, effects, and management of blood lead exposure is crucial for protecting individual and community well-being. For third slide is definition of blood lead. Blood lead is the amount of lead present in a person's bloodstream, measured in micrograms per deciliter. For reference level, the CDC's reference level for blood lead in children is 5 micrograms per deciliter, indicating the need for action and intervention. For elevated levels, blood lead levels above the reference level can have harmful effects, particularly on the development of children.
The next one is source of lead exposure. First point is paint and dust. All lead-based paint, especially in older homes, can create lead-contaminated dust when it deteriorates. Second point is water. Lead can leach into drinking water from older plumbing materials such as lead pipes or lead solder. Last one is soil. Soil near major roads or industrial areas may be contaminated with lead from past use of lead gasoline. Let's move on to health effects of blood lead. Let's start with neurological effects. Lead exposure can impact cognitive development, reduce IQ, and cause behavioral problems in children. Second one, physical effects. High blood lead levels can lead to anemia, kidney damage, and reproductive issues in adults. The last one is no safe level. There is no known safe level of lead exposure, and any amount can be harmful, especially for children. And then blood lead testing and screening. Screening is children should be tested for blood lead levels at age 1 and 2 or as recommended by their healthcare provider. Then testing. A simple blood test can measure the amount of lead in the bloodstream and identify elevated levels. After that, follow-up. If a child's blood lead level is high, further testing and medical evaluation are necessary to determine the source and appropriate interventions.
And then let's talk about blood lead level and regulation. The first one, we go to the children's limit. The CDC reference level for children is 5 microgram per de- deciliter, triggering the need for action. And then adults limit. The OSHA limit for adult worker is 40 microgram per deciliter, requiring medical removal from exposure. And then regulatory oversight. Various agencies such as the EPA and HUD have regulation and policy to address lead exposure. And then what important for reducing blood lead exposure? The first one, we can identify sources, locate and address potential lead sources such as old paint water pipes and contaminated soil. And then the second one is mitigate exposure. Implement proper lead abatement techniques such as dust control and lead safe renovation practice. And then the last one, we can ongoing monitoring. Regularly test for lead and continue to monitor and address any remaining source of exposure. So in conclusion, the first one is protect against lead. Reducing lead exposure is crucial for protecting public health, especially the development of children. And that is important of screening. Regular blood lead testing and screening are essential for identifying and addressing elevated level. And then the last one in comprehensive approach. Addressing lead approach require a multifaceted effort to identify source, mitigate exposure, and maintain ongoing vigilance. And then that's all for me and my group. Thank you for listening and bye.